the last question for you specifically is, how do you, and try to make this concise because we're running out a little bit of time here, how do you treat the painful bunion? And if there's hammer toes, can you fix them non-surgically, or do you always have to have a surgery for them?
Okay.
And tell us what a hammer toe is.
So bunions and hammer toes. So bunion is basically where the metatarsals we talked about are malaligned, or where it sticks too much to the inside of the foot, causing the big toe to go towards the smaller toes. Hammer toes are where the toes become contracted and they sort of bend up, and there's different types and causes for hammer toes. Typically with bunions and hammer toes, you can try splints, or with bunion they have little splints you can wear at night, but truly the problem is the alignment of the bone. So the only way to truly get rid of it is surgery to realign the bone, but that could be a very lengthy recovery and it's not always the most comfortable recovery.
So to stay zoomed in, one would expect pain on this is the inside of the foot, this is
That's
the pinky
correct.
toe. One would expect pain at the base of the big toe.
That's right.
And if that exists, even when they're not wearing shoes, or even after they change shoes to what they consider an ugly Mary Jane style, then or a Birkenstock or something like that, if that pain persists in there, that's when they should really be seeking advice from you.
That's correct. And because there are things that we have available to patients to pad those areas, make them feel better, so you can still tolerate certain shoes and avoid surgery. Hammer toes you can treat by padding and avoiding from rubbing in shoes. The only way to truly straighten it out is to go in there and surgically straighten it out. But there are treatments to avoid the discomfort from it, but it will not reverse the angle of the toe or how prominent the bone is.
So the lesson to our viewers then is there are some conditions that are painful that if they don't get better and they persist, then the right answer would be to seek a consultation.
That's right. And we have and nowadays to where if it does not improve over time, usually several months of treatment, that there is advances that we have now in correcting of bunions and hammer toes. With bunions a lot more, there's different procedures such as the Lapiplasty procedure coming up to where it allows for a lot more long-term better results for patients that we provide here, that you have to travel otherwise to Greenville or Raleigh to find other surgeons who do similar procedures.
Right, and it's not necessary to make that trip.
That's right.
Right. So as a segue into our commercial and into the next segment and last segment of our show, let me share with you that I had a patient 2 weeks ago with hammer toes, and this patient was diabetic. And the toes were so hooked down that they rubbed abnormally against each other and against the bottom of his shoe, and they ulcerated, and he got infected, and it got infected into his foot, and it required multiple toe amputations. That needs to be avoided through patient education, and there are many things that we can do that will prevent you from getting toe amputations, because if the toe amputations don't work because of your lack of blood flow, you'll find that amputation level marching right up towards your knee.
That's correct, unfortunately.
And so the best way to prevent a below-knee amputation, which is not uncommon in diabetics, is to seek wound care immediately if you see a break in your skin, particularly if you're diabetic.